Hello, everyone, and welcome. My name is Dr. Ava Ramirez, NA, and I'm joined by my colleague Kimberly Henry. Both Kim and I work on this project funded through the Office on Violence Against Women, which is titled Advocating for Military Connected Survivors. And this training is just one of the many offerings that we provide through our project to best support you all as community and system-based advocates, allied professionals, legal professionals, and civilian service providers to really help expand your knowledge and services for supporting military connected survivors. We will cover everything that I said and what that means in just a moment, but we are grateful you are taking this training, watching the webinar, and please feel free to reach out to our team with any questions, concerns, comments following your completion. We will provide our contact information at the end. So again, thank you for taking the time out of your busy schedules to enhance your understanding on this topic. This training is 60 minutes long, and the focus is on military connected survivors of domestic and dating violence, sexual assault and stalking, or DVSAS, as it will be referred to throughout this training. So as I said earlier, my name is Dr. Ava Ramirez, NA, and I am the Military CCR Senior Program Manager here at NOVA. I am also a retired U.S. Marine Corps veteran, and I have prior service working as a uniform victim advocate for military sexual assault survivors. And it was really this experience that ignited my passion for advocacy and military victim survivors. Kim and I both have diverse backgrounds and experiences in education, and we are excited to be able to share that with you. And with that, I'll pass it over to Kim.
Thank you, Ava. Hello, everyone. My name is Kim, and at NOVA, I'm the Military Coordinated Community Response Program Manager. And like Ava, I also served in the military. I am a U.S. Navy veteran where I served 10 years as a Navy cryptologic technician. During my service, I was also a sexual assault victim advocate, and that is what fueled my passion and interest in social work. So I became a licensed master social worker and decided to separate from the Navy and become a DoD civilian for the Air Force as a full-time sexual assault victim advocate. And that's what led me to NOVA. So what is our project mission? The mission of this specific project, Advocating for Military Connected Survivors, is to provide trauma-informed and survivor-centered training and technical assistance, or TTA, that empowers legal personnel, victim advocates, and allied professionals to support military-connected survivors of domestic violence, dating violence, sexual assault, and stalking, or DVSAS, as you'll hear us refer to it throughout the presentation. So the objectives of this training, again, is to help you have a foundational understanding of military-connected survivors and their experiences with DVSAS, as well as how to best support them. So we're going to talk about the military environment and lifestyle. We're then going to talk about the different challenges that are faced by military-connected survivors and explore legal protections and resources. We will then discuss promoting effective military-civilian collaboration and enhancing service provision to survivors.
Thank you, Kim. So moving into our first learning objective, which is to educate on the military environment and lifestyle. And to start off, I would like you to take a moment to think of the word military. When you hear that word, what comes to mind? And to start off, I would like you to take a moment to think of the word military. When you hear that word, what comes to mind? And this is an exercise that we do when presenting to different audiences. And although the audiences change, the responses are often very similar. And that is what can be seen on the screen. So a few examples are freedom, structure, service, honor, hierarchy, bravery, guns, and several others. And these are helpful to reflect on because not only do these terms drive perceptions, but they can also influence behaviors, relationships, and relationship building. And they also highlight some of the very unique barriers and unique dynamics that military victim survivors have to navigate. And also, this is why many victim survivors will seek off-base community resources, which is why this training is here. Why we're here is to really support you all as community providers to be able to support that military victim survivor when they walk in your door. I will also say that if you are a provider or advocate that has zero knowledge or experience with the military, I understand that learning about or relationship building with this population can seem daunting or confusing. And please know that you're not alone in that experience, but also don't let that be a barrier from keeping you away from supporting this population. I commend you for taking this first step to learn more by watching this training. And please know that our team here at NOVA can provide additional support as well. When discussing this population, I would also like to address the common negative perceptions or stigmas about the military. And I do this sensitively by understanding both sides. I am and Kim are very proud veterans who actively support military and victim survivors. And we can also acknowledge some of the damage that the military has done and that there's always room for improvement, to include each one of us and also all the institutions that we work for and the programs and services that we provide. And maybe you hold some of those perceptions and they may be keeping you from connecting with military or military institutions. But I would like you to ask yourself one question, which is, why did you choose to enter this field of advocacy or community support for victim survivors? And while you're thinking of that why, for why you are being here and why you continue to show up each day, I will also ask you to consider how, as advocates, we are here to support the individual that shows up in front of us, regardless of the circumstances surrounding the assault or victimization or any personal beliefs or biases. Each of us are very diverse and complex human beings with different lived experiences. And as trauma informed and ethical advocates, it really is our duty to support the person sitting in front of us. So please keep this in mind as we move forward.
Thank you, Ava, for explaining that and starting us into the conversation of military service branches and what does military mean to us or to others and that perception. And to really dive into what is the military, we want to first talk about the different military service branches. These are the different military service branches. The U.S. Armed Forces are broken up into the U.S. Air Force and the Air National Guard. And you see in parentheses there that it says airmen. And you see that with every service branch. For U.S. Army or Army National Guard, it says soldier. For the U.S. Marine Corps, it says Marine, U.S. Navy, Sailor, U.S. Space Force Guardian, and the Department of Homeland Security has the U.S. Coast Guard or the Coast Guardsmen. This is extremely important. And the reason why we have in parentheses the title of the service members who serve in those service branches is because it is extremely important to us as those who serve in those service branches that we are called or referenced to as those service members in each of those service branches. Again, I was in the Navy, Ava was in the Marine Corps, and we have earned those titles, and it is important to us that we are referenced as one of those service members in those service branches. Many people are familiar with each of these different service branches, but we do want to reference them and recognize that they do fall under different departments. But throughout the presentation, when we're referring to military connected, these are the service branches that we're referring to. Let's see. Go to the next slide. Thank you. So why do people join? There are a lot of different reasons why people join the military. And what is most important is to not assume that you know why someone has joined or that all stories are the same. or all experiences are the same or motivations are the same. Each service member can have experiences that are common, but each have their own unique experience and their motivations to joining. And that pertains to everything that happens before they enlisted, during their service, and even after. And it's important to treat this as similar and parallel to their experiences with being a military connected survivor, and it being survivor centered when working with them. We should never assume that two victims of DVSAS have similar experiences, or that their experiences after when receiving support or care has been the same. We need to respect the individual in front of us. And as the expert in their own lived experiences, here are some of different examples of why people feel it's their responsibility to serve their country and join the military. One is family tradition. Some people join the military because everybody in their family or many generations have joined the military, and that's the family tradition. There's also the Universal Military Training and Service Act of 1951 that you see on the left-hand side, or the Selective Service System in 1948, which are different acts and services and legislations and policies that were created that either required or led to the increase in people joining or the requirement of people joining the military. There's also benefits. You see in this center column here, like education and training. Many people know that there are educational benefits and things like college tuition that can be paid for. There are also very specific technical training and certifications that can be paid for or provided by the military. And that can be a huge motivating factor because they can also be extremely beneficial after military service. There's also this sense of responsibility to serve. A lot of people join the military because they feel this sense of serving their country. They feel a pride for their country. They feel a pride in the military. They want something greater than they're participating in, something greater than themselves. There's also health benefits, medical health benefits for themselves or their family members. And that could include not just maybe a spouse or a child, but even adult dependents as well. Then there is the adventure and the escape. I myself am from a small rural town in Kansas, nowhere near the ocean, and I joined the Navy. Adventure was one of my motivating factors, but for some service members, it is a big piece of their reason for joining or their motivation for joining, and having that adventure and seeing the world, but also escape. There's statistics and facts that show that a lot of service members, especially enlisted that join, do have multiple forms of adverse childhood experiences. And so there are service members that are joining to actually escape forms of trauma. So they're coming to military service to escape actual forms of trauma or childhood abuse. And so they're joining the military already experiencing trauma and possibly forms of DVSAS. Go to the next slide. Thank you. So what is the military environment? What you see on your screen now are some different statistics and some considerations when thinking about the military. If you're watching this presentation and maybe you served in the military, maybe you have family in the military, you maybe have heard some stories. There are some things that maybe some common facts that people are aware of, or some common considerations that you have been aware of when it comes to the military. There's a lot of enlisted individuals that are in the military. We know that there's military deployments. There's a lot of separation, but it's really important and key to remember some of these facts that are here on the screen when we're talking about military connected survivors of DVSAS. One of them is the fact that, again, a lot of them are enlisted and their age range is 17 to 18 years old, so very young. And 82% of this military service branch service members are enlisted, and their average age is 27 years old. Considering that brains are not done developing in humans until we're about 26 or 27 years old, When we're talking about trauma, we're talking about military connected survivors, a DVSAS, and we're just talking about the military environment and what's expected of military service members and the jobs that they do, the situations that they're put in. You start to really think about the kind of environment and the situations that they're put in that can lead to higher stress or higher trauma or exposure to things that maybe their civilian counterparts are not necessarily exposed to. 18% are officers, and that average age is 34. And that can be contributed to different things. Officers are required to have a college degree, and that could be part of it. But there are different reasons for that. Part of the military environment as well is hierarchy, structure, and regimented. And as Ava mentioned on one of the previous slides of what people think about when they think military, these are three common words that we see very often, and you probably had seen some of them on that slide. There is a structure, there is a hierarchy, there's the order, there's the chain of command. These are very common words, phrases, or terms because the military does have that order. They do have that chain of command and that structure. They do have that leadership. And there's reasons for that. And having that environment, there are many people who join the military who have never had that environment. And even for individuals who may come from a military family or military background, or maybe even a military child whose both parents were in the military, they've not necessarily served in the military themselves. So they're still joining an environment where they're surrounded by that hierarchy. They're surrounded by that structure where it's completely regimented and where they're always told where to be, what uniform to be in, what time to be there, what they're going to be doing. And their ability for their right in a way to make decisions are kind of done for them. Next is there's a high stress. There's a lot of deployments. There's the separations. There's the trauma from that separation. There's a lot of decisions that have to be made that, again, civilian counterparts don't necessarily have to make. Separations are not necessarily voluntary. You can also do your best to make decisions and prepare to ensure that separations are decreased. You can do everything to plan to try to prevent from being separated, maybe, and from your family, and maybe complete a deployment on time so you can move with your family to your next duty station. But what if that deployment gets extended and now your family, maybe it's a young family, is managing that move on their own, and they're moving the entire house and all those household goods with a young child on their own? That can lead to stress. There's so much that's out of a service member's control that can lead to that stressful environment in the military. There's also increased risk of different forms of trauma or other things like substance use and abuse, and also high risk behavior. It's also important to remember vulnerability is seen as weakness. This is a common awareness in the military and also outside the military. When you see commercials of the military or promotional videos of the military about join the military, we're tough and we're strong. I don't think I've ever seen a commercial about the military where that's not promoted. And a lot of people connect being strong and not being vulnerable or not being weak with the military. And so being vulnerable, showing emotions, showing feelings, although the Department of Defense and although the military has really worked hard to bring things like mental health and bring talking about your emotions and getting help to the forefront and making it a priority, discussing or talking about or admitting that you're vulnerable or that you do need help, it is a form of weakness, and it is still very much not discussed. And that sense or that mindset or that idea of vulnerability and it being a weakness is still very much present in the military environment.
Thank you, Kim, for that overview of the military environment and lifestyle. And it really does show us all of the different complexities of the military that we need to consider that victim survivors have to navigate, and why there are different barriers and challenges. So, when we are looking and talking about the military, how many military connected people are there? Well, listed here are DoD statistics from 2022 for active duty members, and that is showing over 1.3 million active duty members, which is pretty significant. However, keep in mind that these will greatly increase as we begin to include our other military connected individuals. We also have on this slide the breakdown of the branches by size that are part of the DoD, with the Army being the largest and the Space Force the smallest. And again, this data is showing the predominance of male service members on active duty. Data for the active duty families. So these can point to why many families may need additional support due to having multiple children, one primary paycheck, and a majority of the spouses are shown as being female with the average age of 32 years old. The second chart in the top right corner includes children and adult dependents. So important to consider and understand that many military families not only have spouse and children, but older adults that they help care for as well, such as parents or grandparents. All of this data is available on Military OneSource. We have included those links. And they also have an interactive dashboard for these statistics as well. So I encourage you to check those out. And where are the active duty highly located in the US and around the world? So these next slides have breakdowns of active duty and also veterans. And on this slide, it does depict the breakdown of active duty with the highest populations in California, Virginia, Texas, and North Carolina. And this is just likely due to the number of military installations in those states. However, keep in mind, if you're not in one of those 4 states, it does not mean there aren't military connected individuals near you because of all those other individuals that Kim covered earlier. So veterans in the US, here is the breakdown. We like to show these numbers as they like to illustrate that, again, just because you don't live near a military base or installation, that doesn't mean there aren't military connected individuals around you. Again, consider the active duty, veterans, National Guard, reservists, and their families who will most likely be coming into your community support services as well. We do not want our unawareness of this population, of their unique barriers and challenges, to be an added barrier to helping military connected survivors. So now that we covered military environment and demographics, let's move into our discussion on specific challenges faced by military connected survivors. So to begin, let's clarify who military connected survivor includes and should have access to military resources. Again, keep in mind that some military victim survivors will choose not to use military resources and will be coming to you all in the community. So listed here are those groups: active duty, veterans, reservists, National Guard, and civilian dependents. Additionally, intimate partners. Victim survivors are included as someone who has been or is currently in a relationship of a romantic nature, such as a current or former spouse, dating partner, someone who shares a child or has shared a home at the time of abuse. Also important to remember is that National Guard and Reserve members and families can receive supportive services such as mental health and counseling if the abuse occurs while in that active duty status. However, they are unable to file a report and receive law enforcement assistance unless that abuse occurred while active. National Guard have sexual assault victim advocates. However, they do not have DV advocates, domestic violence. Therefore, they would receive services off the installation. For veterans specifically, they are permitted to receive limited services on installation. However, they will rely heavily on the civilian agency or sometimes Veterans Affairs, which we'll talk to later on. So there are some unique dynamics and criteria that can influence services for military connected individuals. And I understand it might be a little confusing, but again, this is why it's important for you all to have this general understanding and also to connect with your local military victim advocates who can help support you.
Thank you, Ava. And a couple more statistics that we want to share with you is really talking about the rates of domestic abuse and sexual assault in the military. First, what you see here is the rates of domestic abuse in the military and a chart that shows the fiscal years 2015 to 2019. It breaks it up between the different service branches of the Army, Navy, Marine Corps, and Air Force. And from this report, you see that it shows the incidents that met the Department of Defense criteria for domestic abuse, which is the physical, emotional, or sexual abuse or neglect. But it doesn't necessarily show you how many incidents were reported that didn't meet criteria, nor does it tell you how many incidents were maybe all four of these categories. But what we want you to take away from this is that one, it is happening in the military, and two, that as a community advocate watching this, the DoD does have a criteria. They do have a definition for domestic abuse, but the definition and the criteria is different in every state. It's different across the country and it's different across the world. So wherever you're watching this in the world, consider how the Department of Defense criteria may not necessarily meet that same criteria or definition where you're at. And so a military connected survivor may be reaching out to you because maybe what they're experiencing does not meet the Department of Defense criteria. But that does not necessarily mean that they're not experiencing domestic violence, interpersonal violence, or another form of domestic abuse that either meets your criteria or just really is some sort of violence that they need your help with. This chart here shows the rates of sexual assault. Every year, the Department of Defense Sexual Assault Prevention and Response Office comes out with an annual report. And there's a chart that is similar to this one that is usually in the annual report. And what you can see here is the individual service unwanted sexual contact, or USC, prevalence. And it is also divided up by service branch. And you can see this is from the year 2023. And it states the divided up between women and men, with it happening 7.4% in women, ranging up to from 4.6% in the Air Force for women up to 10.8% for the Marine Corps. And then for men, 0.8% up to 1.8% in men. But you also see down below, it says of female service members who indicated an experience of unwanted sexual contact and reported it, an estimated 26% experience a behavior that met legal criteria for retaliation. And so again, we know that that unwanted sexual contact, sexual assault, sexual harassment is happening in the military. We know that different service branches handle or investigate sexual assault, sexual harassment, domestic abuse differently. The service branches also have different offices, and the names of those offices are different. And this could be a reason, many of the reasons why a military connected survivor may come to you as a victim who, as you as a community advocate, coming to you seeking help. And even though you may not understand all the different offices, all the different definitions and criteria, you do know that it's happening. And you do know that you have the capacity to help them as a victim advocate. And we're going to discuss some of the reasons, some of the experiences, some of the challenges that they face, and some of the ways that you can help them. So what are some of those challenges? Again, with DVSAS happening in the military, if you have a victim that is coming to you as a community advocate for help, what are some of those challenges that you want to consider? What are some of those things that they are experiencing being a military connected survivor that maybe their civilian counterparts could be experiencing as well, but not necessarily in the context of being military connected? One is alienation. Alienation and isolation is very common in the military, and it can be compounded because in the military or being military connected, you are moved away from your hometown. And even if you're not a spouse or married or a dependent, even as an intimate partner, if you're military connected and you share a child with a military connected person and you've experienced a military connected DVSAS, that person or the person who is supporting you, the person who is helping you, if they end up being deployed or they are moving and you cannot at that time move with them, maybe you are being separated from your support system. And so there's a lot of different ways that you can be isolated. Maybe you are a spouse and you are the abuser of the person you're experiencing abuse from is the active duty service member, and you are both living in Germany, but you're from a small town in Georgia. Your entire family lives in Georgia in the United States. That isolation, that alienation, and that separation is again compounded because you're in a whole different country. And it can be very difficult to return back to the United States. It can be very difficult if there's children involved. And so again, that isolation is compounded by being in the military. Next is the financial concerns or the benefits. A lot of people recognize that the military does essentially offer or guarantee a consistent paycheck. And there are benefits that come with that, including things like basic housing allowance or other allowances like cost of living allowances, especially in areas that have very high cost of living. And when a military connected survivor is experiencing forms of DVSAS, especially spouses, and especially when there's children involved, or again, an intimate partner who may not necessarily be a spouse, the financial concern could be that if they report their abuser, who again may be the active duty service member, or again, even a National Guard or reservist, that victim could be very concerned about impacting that alleged abuser's career and those financial benefits and those allowances, which ultimately impacts the victim and their children as well. So that also allows that abuser to have more financial control and abuse over that victim. A lot of times those allowances and those benefits could be really hard to navigate for spouses, for dependents, and of course for intimate partners as well, who may share a child with that individual. And that can allow, again, for further financial control. And a lot of community advocates also may not be aware of the certain rights that military connected survivors have to those financial benefits. But that is another challenge that military connected survivors have to navigate through. Separation and deployments. This is another challenge that's very unique to the military. Again, not just because of the alienation, but also because separation and deployments are very much out of the control of the military service member and their families. And again, it's not necessarily always the spouse or intimate partners or dependents that is the victim. It also is active duty service members. And so if you can imagine an active duty service member who is the military connected survivor of DVSAS, maybe they're currently experiencing domestic violence. Maybe they've recently experienced a sexual assault. And 3 days later, they're told they're about to go on a 10-month deployment. Imagine the state of mind that they're in, and they're about to go on maybe they're in the Navy, they're about to go on a ship for 10 months. And guess who also is going to be on that ship? The person who is their offender, and they're going to be on that ship with that person for 10 months. And they have 3 days to mentally, emotionally prepare for that, right? And so the deployments and the separations can add so many more unique dynamics and challenges for that military connected survivor. Next is retaliation. You have to consider in the military that you eat, you sleep, you work out, you shop, you go to the post office. You do everything on a military base, especially in other countries. Your kids can go to school on your military base. Everything can happen on a military base, let alone alleged offenders can be in the same units, this unit of 30 people, 15 people. And also they can be in your chain of command. They can be your supervisors. They could be your subordinates. And so it's extremely important to consider that in the military environment, you have to think about the retaliation that can happen. Retaliation does happen. It's very hard to document. It's very, it is a huge motivating factor for people not to report and not to seek help. And it's a huge challenge to overcome when people do report and can want to continue pursuing getting help. And so retaliation is a challenge, again, that military connected survivors have to overcome to be able to continue to seek help. Another is suicide and suicidality. We know, not just considering military connected survivors of DVSAS, but just the military environment in general, there's a lot of data regarding suicide and suicidality with the active duty and veteran population. And then adding the layer of the military connected survivors of DVSAS and the mental health challenges, the mental health experiences that are compounded because of the DVSAS experiences and the increase in risk for suicide because of those experiences. Next is fear. There is a lot of fear when it comes to the entire experience, not just the reporting, but the fear of what it's going to do to that survivor's career, what it's going to do to their performance at work, what that person can do if that person is in their chain of command, if that person's in the same unit, if that person works with them. It's a very small community, the military, and even more smaller is if it's in the same job. I, again, was in the intel community. You would think that the intel community is huge in the military, but you'd be surprised how many times you hear or see the same names over and over again in your career. It's the fear constantly that you may be experiencing or seeing the same people and how that might impact your career or your well-being or your family's well-being. Next is the retirement or discharge. When you think about being the retirement or discharge or a separation from the military, this is very difficult. A lot of people consider, veteran suicide is just the mental health from their service, but it's actually a big piece of that is the transition to being a veteran. Military service members don't join the military realizing that they'll one day be a veteran. And so when service members are separating from the military, they really go through a grieving process when they separate or when they retire, especially for victims and survivors who are leaving the service because of an assault or because of abuse. Nobody joined the military to become a victim or a survivor of DVSAS. And so they're feeling that betrayal, which we'll talk about in a moment, of institutional betrayal of leaving the military service. And that's not necessarily what they want to be doing, but they're leaving because of their experience of DVSAS. Next is that camaraderie and that family bond. You do not want to be the one person that stands out. You do not want to be the one that goes against the grain, especially if you're in a small unit, especially if you are in a high stress unit, like a combat unit, especially if you're on deployments. Again, it's the military is a family. The military has a very strong bond. Even if there's a group of people and half of them don't get along, when there's tension, it's amazing how the camaraderie of everybody coming together and that one person can get singled out. And so that bond and that camaraderie can be very strong. And that's another challenge a survivor may have to overcome and they may experience. Next is PTSD and TBI, post-traumatic stress and disorder, and traumatic brain injury. This is often not considered when it comes to military-connected survivors of DVS. When you hear about the military, you hear about PTSD, and TBI. Oftentimes, it is really just paralleled or factored into military service members who have deployed or who have been to combat. But many times it is not applied to military-connected survivors of DVSAS. This is a concern because essentially what that does is that dismisses military-connected survivors' experiences and the reality and the severity of their experiences. So, for example, if you have a survivor who does have PTS or even TBI from their violent assaults, you're telling them that if you didn't go to combat, then maybe your experiences in the military weren't too bad. when in reality, their experience with DVSAS was extreme and it was bad, and they do have PTSD, and maybe a TBI. They didn't need to go to combat to experience that. Their DVSAS experience did cause that. And last is institutional betrayal. Institutional betrayal reinforces that us versus them perception, because the retaliation, the blame, the shame, not being believed, it has just these devastating impacts on relationships with anyone who belongs to these groups, which is why it's really important for our professional relationships, the partnerships that we create, the different programs that we develop, how we communicate with survivors, how when they walk into your offices as a community advocate, how you build that trust with them, because they feel that they have been betrayed by the institution that they joined, that they wanted to be a part of, that they enlisted, that they, raised their right hand to be a part of. And so they feel a level of betrayal by an entire institution. And all this to say, I want to point out that when you're considering all these different challenges that military connected survivors experience, that in your professional role, that when I recommend, and Ava and I do this a lot in a lot of our presentations and when speaking with others, that prior to immediately thanking a military member for their service, I want to consider all the different complexities and potential trauma. And just an easy ask for you to do is just ask, are you comfortable being thanked for your service? And we do both understand as veterans ourselves that people thank us for our service all the time. And it's very genuine. And we recognize the intent that people want to thank us for our service. Thank you for what you've done. But it is an easy ask, just to have that one question: are you comfortable being thanked for your service? It can help build rapport. It can help empower a victim and survivor for their choice and their autonomy. Next is a couple different policies that I want to bring to your attention that I recommend you reading if you have some time. It's some of the largest developments that we've had when it comes to policies in the DoD for sexual assault in the military, primarily the Independent Review Commission in 2021. That was ordered. It was a 90-day independent review commission, and it led to more than 80 recommendations. There's a full report on it. There was, after the murder of Vanessa Guillen, there was a full investigation, and this Independent Review Commission, or the IRC, was to identify and really have an independent, as it says here, an impartial assessment on the military's approach to sexual assault and sexual harassment, and how the cases are handled and what the prevention and the response efforts look like. So there were recommendations and sub-recommendations made. Some of those recommendations since have been made and implemented. Some are still ongoing. It's a very interesting report, and I think it would be great as a community advocate for you to read it. Next is the Executive Order 2022 and 2023 of the National Defense Authorization Act for fiscal year 2022. That established the Office of Special Trial Counsel, and we're going to briefly go into the legal protections next. But it's really important because it allowed sexual assault cases to be handled essentially outside of the military commander's hands. Prior to this, all sexual assault cases were essentially left up to the commander of the units rather than being handled outside of the commander's hands. There's also the hiring and training and empowering of the prevention workforce and improving the military's response to both domestic violence and sexual harassment. And then there were also amendments to the manual for court-martial.
Thank you, Kim. Again, such great information. We know we are providing you a lot. Please take a moment. You can pause the recording. You can always rewatch this and also reach out to us for questions. And as we move into legal protections and resources, I do want to preface that and say that Kim and I are not attorneys, legal professionals, or experts in this area. On this project, we do have amazing partner organization, the National Crime Victim Law Institute, or NCVLI, who is able to support in more depth. However, we do want to highlight this topic because legal jurisdictions and the different criminal justice systems often become a point of confusion, contention, and challenge for military and civilian relationships. We understand that those are confusing, especially if you do not work in those fields, but know that it's okay. You don't need to have all the answers, but you do need to have the relationships built to connect with those who do. So we will provide a brief overview of MPOs and CPOs because when discussing DVSAS, it is important as advocates to have a general understanding and to seek out more information for your city, county, state, and jurisdiction. And again, connect to military advocates and legal personnel. So when looking at protective orders, what is most important to understand for MPOs and CPOs are the differences in who issues them, how and who enforces them, and the limitations. MPOs are only issued to service members by their command. There also are things such as no contact orders that commands can issue. However, we always recommend for a victim survivor to obtain both a military and civilian protective order. Oftentimes, MPOs are quicker to get than CPOs, and commands can also limit base access to civilian offenders. Again, we do highly encourage you to connect with your local military law enforcement, legal personnel, because again, state and jurisdictions are going to differ, and civilian law enforcement should know how to respond if they encounter a military individual violating an order. Because like it says here, civilian law enforcement cannot enforce MPOs. However, they can contact the base military law enforcement and vice versa. If that military police officer encounters a victim, survivor, or an offender where there is a civilian protection order in place. Again, we cannot stress enough the importance of having pre-established and maintained relationships in advance. And with that, I will pass it over to Kim to talk more about collaboration.
Thank you. So with all this information, as Ava said, we don't expect you to be experts, but we do want to see military and civilian collaboration. So we're going to share some tips on how to do that with this information that we've shared with you today. And the first step to do that is to download one of the tools that we've developed for you, our Military Civilian CCR Team Development Toolkit. It is a checklist that provides new and existing CCR teams with a step-by-step guide to assess and engage and elevate the unique needs of military-connected survivors within a community CCR approach. So essentially what this means is how do we get a military agency or agencies and civilian agencies or community agencies to work together? Maybe you don't have a military base in your area, and that's okay. But you know what? You probably have military connected individuals and military connected survivors in your area. So how do we get the resources that we need? How do we have military representation within our community agencies, within our community advocates to come together and ensure that military connected survivors of domestic violence, dating violence, sexual assault, and stalking have the resources that they need, and that there is a coordinated response, and that these survivors get the resources they need, but also that we work together and that we know the information that we know that we need to know, and that we can reach out to us, Ava and Kim, to provide any tools that you need to fill any gaps that there may be in your services.
Thank you. And so why are we highlighting this CCR process, this tool, the teams? And that's because, as mentioned in the beginning, one of our project goals and mission is to help communities establish those relationships that are collaborative, productive, and effective to really combat DVSAS with their military counterparts. And again, one way we do that is to encourage and help facilitate the development of coordinated community responses, or CCR teams. And they are these multidisciplinary teams of military and community partners that meet regularly to really assess, plan, monitor, and evaluate prevention and response efforts. They are a working group, not an advisory council, and they do not discuss individual cases, but focus on that macro level work by helping to identify gaps and themes in their specific community. and also how each of those key stakeholders, such as law enforcement, legal personnel, and advocates, play a part in that response and also prevention. Now, with CCRs, there are a variety of ways these can be structured, and each CCR is going to look different depending on the community. So I'd like you to take a moment to think, are you connected currently with a CCR in your community? Does your community even have one? And are military personnel included in those meetings? Because overall, when CCRs are operating at their best, the services that victim survivors may access in any given community become less fragmented, more holistic, trauma informed, and accessible. So, the first step in developing a CCR approach is really to bring the right folks to the table to help you plan, assess, and engage. So, sometimes communities will bring a core team of prevention and response personnel to begin with planning, and they have the intentions of adding other folks later. However, we do need to ensure that all communities are represented and key stakeholders need to be invited early on in the process to really co-create this response. And ensuring that those right folks are at the table will strengthen a committed team who will really help carry out this collective approach. So, most importantly, the team must actively work towards shared agendas, goals, and the ultimate vision of ensuring that victims are safer as a result of reaching out for help. I understand again that each CCR team, depending on their purpose, will be unique. However, for the purpose of preventing and responding to DVSAS, we have established these three steps to assist in implementation. I'm not going to go in detail, but I do encourage you to reflect on these steps and assess your current or future CCR team with that self-assessment tool that Kim just discussed. Also, keep in mind that if you decide to invite military members to your existing CCR, it's important to consider how they will be integrated into the team. And also, if there's going to be sufficient time and space to elevate the unique issues of military connected survivors. So, one question to ask yourself is, will your CCR address DVSAS of military connected survivors, or do you need separate committees and teams? So, when talking about CCRs across military and community, one significant roadblock is that there's often distrust between civilian and military agencies. And where these issues stem from is around a lack of understanding for the different cultures and communities, and also concerns about confidentiality and information sharing. So again, it's really important to consider how you will address these potential roadblocks from the beginning. And that might include cross-training, again, building relationships, developing MOUs, and encouraging committee members to share other challenges that they anticipate when developing their CCR teams so that you can successfully address these and plan for them in the beginning. So speaking of potential partners for CCRs and also those who you should connect with as advocates and service providers, listed here are some military agencies that should be considered. Everything from their direct victim advocacy services for active duty and also veteran services and health clinics. While understanding that many military victim survivors may not want to go to any military related agency for support, which is why they will come to you all in the community. So connections with these individuals and these programs is going to be critical because we want to make sure we're providing all of the potential resources and rights afforded to military connected survivors. And speaking of community agencies, you all watching this training, here are some examples listed here. We also recommend these to military advocates when we are talking to them, while recognizing that social service agencies, nonprofits, law enforcement, and government agencies are overwhelmed and operating with limited resources. Similarly to the military environment as well, to include high turnover rates. So we're having some of the same challenges on both sides of the fences, but that is why working together, working collaboratively, and having these teams can really begin to provide more fluid prevention and response efforts and share the responsibility across the CCR and the agencies.
Thank you, Ava. And with that, just know that we are here to help. We are here with tools and guides and training and technical assistance. Our intended audience is OBW grantees and potential grantees, which includes agencies or organizations that you may work with that are not currently OBW grantees, but could be potentially because of the work they do. So again, we provide training and technical assistance to advocates, law enforcement, legal personnel, court staff, healthcare providers, social workers, and more. So if there's even a question about who we can provide help to and who we work with, please reach out to us. If you're supporting a DVSAS survivor, if you work with anyone who's experienced domestic violence, sexual assault and stalking, and you don't know if you work with military connected survivors, you probably are. Maybe you don't know that you're working with military connected survivors. We can tell you how to figure that out and how to build rapport with them. We do that through the different tools, the different trainings that we provide. We have communities of practice where we connect you with other advocates who share some of the same challenges that you may be experiencing and also have solutions to those challenges. So we are here to help you. So where do you start with all of this? Our recommendation on where to start is the organizational self-assessment. We already shared one tool with you. What this tool is a tool to assess your readiness in supporting military connected survivors. So how ready are you to support if a military connected survivor of domestic violence, dating violence, sexual assault, or stalking were to walk through your doors? Is your office prepared? What kind of setting does your office have and the perception of military connected individuals? Does your team have a perception or an attitude towards the military that is positive and uplifting? Do you have the knowledge about military programs and services? Do you just know to call military law enforcement or not? Because that may actually impact their reporting options. What do you do? This tool will help you identify the strengths and also your areas of improvement. And from there, again, you can contact us and recognize, hey, we actually might need some support in these areas. And then you can, by reaching out to us, we can tell you how to fill those gaps and what tools we have to help you fill those gaps, as well as different trainings and other resources to help address those needs. So what are your next steps? One, complete the organizational self-assessment, but also review and reflect on everything that we've shared today and identify at least one new strategy or tool like the self-assessment that you can implement. And then reach out to at least one new potential military partner. We recognize that if you've never worked with the military, it can be very daunting. It can be very overwhelming. We do not have an intended audience of the Department of Defense or the military. We are here to support you as community advocates. But we also recognize that military connected survivors do have rights and confidentiality options like restricted reporting. And so by connecting as a community advocate to those military agencies, you can create partnerships and memorandums of understanding to be able to ensure that those military connected survivors keep those reporting options. They're able to keep that confidentiality and keep those rights. And by connecting with that military partner, you can ensure that you're building a coordinated community response and ensuring there's a smooth transition, a smooth process for that survivor, that they can get the help that they need with the autonomy that they need, and they're able to make the choices that they want.
As we close today, we want to sincerely thank you for taking the time to view this training. We hope that it has been beneficial for you and your team, and that it can be that first step to spur your curiosity and empathy to learn more and take those next steps that Kim spoke to. Also, we encourage you to please share this training, our resources, and our contact information to your colleagues and other community partners that would benefit and really be a part of your CCR. If there is anything that we can do to support you and to tailor to your specific community or organization, please let us know. And thank you again. We look forward to hearing from you.
Yes, thank you.